Victoria's latest coronavirus outbreak now stands at 69 cases after 5 more locally acquired infections were identified overnight. The toll's steady climb comes as health authorities work to track the source of a highly infectious strain of the virus in the community. Reporter Oliver Gordon joins us now from Melbourne. Oliver, take us through the latest that's known about the 5 new cases.
Okay, well, I'll try and give you a bit of a breakdown of the 5 new cases, taking the state's total up to 69. So 2 of the 5 new cases are linked to a West Melbourne outbreak. That's an outbreak that has the Delta variant, which is more contagious and has authorities quite worried. One of those is a colleague of a family who recently travelled to Jervis Bay in New South Wales. The other is the child of a second family connected to that West Melbourne cluster. There are 3 other new cases. 2 of those cases are unlinked cases, meaning contact tracers haven't yet worked out where they contracted the virus. The last of the 5 new cases is connected to an aged care worker at Maidstone Aged Care Home. Chief Health Officer Brett Sutton reassured today that 3 of those 5 new cases were actually quarantining during the infectious period.
Certainly it's been gratifying to have 3 of the 5 new cases effectively in quarantine during their entire infectious period, so minimal, if any, new exposure sites listed for them. The 2 new cases who have not been identified as primary close contacts previously do have that, again, link to Craigieburn Shopping Centre and Epping Plaza Shopping Centre. They were frequent attendees at both of those sites. We haven't got a definitive crossover time with known cases.
Brett Sutton there. Now, Oliver, regarding that new strain that is of particular concern, the Delta variant, health experts have been saying that it might be hard to track down the source of that infection.
Yeah, well, yesterday Victoria's coronavirus outbreak story took an unexpected turn when we discovered that there is this Delta variant in the community connected to this West Melbourne cluster. Obviously, authorities are trying to work out where it came from, how it came to be here in Melbourne. Professor Sharon Lewin is part of the effort to track down those things. She's doing genomic testing and the like. This is what she's had to say so far about how they're going, working out where this actually came from.
At the moment, we don't have a match. So 20% chance that we don't have a match. So therefore, how could have a transmission had happened? It could well be from a person that was positive in quarantine in whom we don't have that genetic sequence. Every effort is being made right now to look for that match, but we may not get the match.
That's Sharon Lewin there. And Oliver, there are some concerns regarding some residents in public housing towers. What do we know there?
Some relatively good news on that front today. So yesterday it was identified that there were up to 5 primary close contacts connected to this West Melbourne cluster. That's the Delta variant cluster in inner city public housing towers. Today it was revealed tests coming back from those people are showing negative results. The Health Minister, Martin Foley, spoke a little bit today about vaccination rates in those inner city public housing towers. He praised the efforts of a lot of community health groups who have health concierges on the ground trying to spread information about the importance of vaccines, but conceded that rates in the towers aren't quite as high as he'd like them to be. So obviously monitoring these primary close contacts in the inner city public housing towers, but today some negative results, some good news.
Our reporter Oliver Gordon there with the latest in Melbourne.